Okay, this video is called What's the Difference Between Internal Medicine and Psychiatry? And internal medicine has a lot of problems, but psychiatry is much worse. We'll explain what that's about real quick here. Okay, so this is Alice in Wonderland, and she meets up with the caterpillar who's puffing on the hookah, and when she talks to him, she realizes he's just blowing smoke. He's, fancy talk, but there's really no substance to what he's saying, and that's the foundation of internal medicine. It pretends to be based on science, but it's actually a big joke. Okay. When you look closely at the so-called science of internal medicine, you realize it's just stupid. I mean, a perfect example is hypertension. You read the hypertension book, and I've got one over here. Can't show it to you right now, but I'll talk about it some other time. Basically, it'll tell you 95% of hypertension, idiopathic, the doctor's an idiot, the patient's pathetic, nobody knows the cause, it's essential hypertension. But then you read the epidemiology, and you'll see that there's like close to zero hypertension in plant-based communities. Things like, Kenya 1929 Donaldson paper in the Lancet Journal, okay, 1,800 consecutive admissions, no hypertension. And the people like Yanomamo eating a plant-based diet got normal blood pressures in their elder years, and that's sort of the natural course in those populations. So that also helps get you away from the paleo, keto, carnivore, Mediterranean diet type stuff that, it's not just an improvement, it's a dramatic difference, okay? So it's like a house of cards, the whole science of internal medicine. The modern papers are largely bought and paid for by the big corporations. They're a joke, okay? Most science is not really science, it's just advertising, okay? So what's the significance? Here's the significance of what happens in internal medicine. Basically, it's just a waste of the patient's time. You're giving these pills, it'll slow down the disease perhaps a little bit. Sometimes they make it worse, but sometimes they'll slow it down a little bit. And the doctors mean well, but they really don't know very much. They haven't been trained in nutrition, epidemiology, toxicology. Those are the three main things you have to know about disease, and they don't know them. So the reality is most internal medicine doctors are very ignorant of disease. All they know is drugs. That's what they were taught, and that's yielded a pill, send a bill. So basically the patient just walks around in BS and wastes time. And hopefully if the patients are smart, most of them are not, they can wake up and bounce out of this and eat a low-fat, low-sodium vegan diet with no oils, and they got a chance to cure these diseases. Internal medicine says there is no cure. That's why they call these diseases chronic. Okay, so that's what internal medicine is all about, wasting time. And the problem with wasting time is that'll go on for decades. And after a couple decades of that, sooner or later, the patient might have a irreversible event, like a heart attack, myocardial infarction, or have a stroke or something. So you want to get your act together before it becomes irreversible. And when you start reading the nutrition papers, about low-fat vegan diet, you see all these people being cured. You're like, my gosh, it's like Alice through the looking glass. She gets to the other side and she sees everything from a totally new perspective. That's what it's like to learn about nutrition epidemiology. You're like, wow, I had an internal medicine doctor, and that's what he said to me. He says, Pete, all the stuff you're talking about, that's not just the key to coronary artery disease. That's the key to almost everything for helping patients. And okay, now we'll briefly just mention psychology. Psychology, like I said, they're the priests of modernism. They just go along with whatever nonsense comes up. They don't question it. Somebody tells them you need new pronouns. They're like, okay, typical, this is a little comment from a psychologist. Are you ready for me to diagnose your totally normal reaction to our messed up society as a mental illness so then I can get you sent to a psychiatrist and become addicted to mind-altering drugs for the rest of your life that are going to lower your IQ? Okay, so that's kind of one of the problems. And then the other nonsense in psychology, how are they going to tell you anything about relationships when they don't even know the difference between a man and a woman? It's not that complicated. A man has a Johnson, a woman has a Virginia. Okay, that's what it's always been, and everybody's pretty comfortable with that. You look at animals when they're born, nobody asks them, we can tell if it's a male or a female in animals. Okay, so here's my point. This is a lady sinking in quicksand, and that's what psychiatry is. Those drugs cause progressive brain damage, and some of them are much worse than others. The antipsychotics tend to be much worse than the other ones. And so if a person doesn't bounce out of that pretty quick, it'll often ruin their life, suck them down, start lowering their IQ, making them sicker and sicker and sicker. So psychiatry is much more rapidly dangerous quite often than is internal medicine. So anyways, that's a comparison right there.